Hello, my name is Andy Nimri. I'm your local pharmacist here at Pharmacy Plus in Jacksonville, Florida. Today we will be discussing a very common medical condition, and that is a stroke. Facts about the stroke. It's the fourth leading cause of death in the United States, with almost 800,000 people suffer from a stroke each year. About 130,000 of those die, and there are over 7 million people living with a stroke in the United States. What is a stroke? The stroke is where the blood supply is basically cut off of the brain. It stops oxygen, stops nutrients from reaching the brain, and it damages or kills the brain cells and stops parts of the brain from working properly. There are two main types of a stroke. There is an ischemic or a clotting stroke, and that presents about 87% of strokes are this kind, basically the ischemic stroke. The other remaining 13% is the hemorrhagic stroke or bleeding stroke, where there's a bleed around the brain and bleed into the brain. There is something also that's very popular that we hear about all the time in the radio advertising, something called TIA. They say if you suffer a TIA, you should immediately seek medical attention and go to your closest ER. What's a TIA? A TIA basically, it stands for transient ischemic attack, and it's a warning sign for future strokes. And the symptoms of TIA are basically the same as of a stroke. And the TIA symptoms can resolve within minutes or hours. If you develop what they call a TIA or a mini stroke, you definitely and quickly get medical attention, because this can convert to a full-blown stroke, or it can also do that later in time. So you have to address the medical condition now, so you prevent it from getting out of control and being a full-blown debilitating stroke. What are the stroke symptoms? Sudden and severe headache. Usually the patient will tell you, this is the worst headache I've ever had in my life. Trouble seeing in one or both eyes. Dizziness, trouble walking. Sudden confusion, they don't know where they are. Trouble speaking, they can't repeat a sentence. Sudden numbness or weakness of the face, arms, or leg. Basically the extremities, arms, or the face, you see sudden weakness usually in one side or the other. And remember this word fast, F-A-S-T. Fast starts with the face. So you look at the face, you tell them to smile. Does one side fall to versus the other? So you'll see, like, especially like around the lips here, you'll see like they're tilting either side to the right or the left. Arms, they usually cannot, if you tell them to lift both upper extremities, and if you put your hand to press against it, they cannot resist it, they cannot hold it, they cannot, one of the arms basically drift downward. Speech, slurred speech, difficulty speaking, difficulty repeating a sentence, they don't sound like they usually sound. When you see these, you need to act very quickly, because time is of very critical at this point. And the reason time is very critical, because if you take the patient quickly to the ER and they address the situation very quickly, there are medications that they can use and that can basically help survivor, help the quality of life thereafter. And those medications have to be used within 3 to 4.5 hours after the onset of symptoms. So that's why time is very important, not only if, for using the medications, because the more blood supply you keep going to the brain, basically the less likelihood of those cells die, and the less likelihood of having these disabilities that happen after a stroke. That is why it is very important to not only be able to notice these strokes, but also to address on them and take the patient quickly to the ER. Why would some people develop a stroke? why would some people don't develop a stroke? What are the risk factors? There are certain risk factors, and there are some that basically you cannot do anything about, like age, gender, race, any family history of the stroke, or any previous mini stroke. So a mini stroke, they say, oh, this is just a little dizziness here, and then everything comes back. This is a sign that something's brewing inside. So this needs to be addressed. Things that are modifiable, the things that you can do something about, is basically things like high blood pressure, controlling high blood pressure, going to the doctor and checking the blood pressure on a daily basis to make sure you don't have high blood pressure. Diabetes, high cholesterol needs to be addressed, because these three evils, the high blood pressure, diabetes, and high cholesterol, these are the factors that are very important in a building block for a stroke. Heart disease is very critical, especially a condition called AFib, where basically the heart does not pump regularly. It's a symptom of poor conduction in the heart, and this is called atrial fibrillation or irregular heart rhythm. And what happens, the blood needs to be moving and moving quickly and moving in a rhythm. And if the heart is not pumping effectively in a rhythm, the blood tends to stay in the chambers of the heart longer than what is supposed to stay. And that can make the blood basically clot. The clot gets bigger. The clot, when the heart starts pumping, moves back to the body, goes to the brain, and causes a clot over there. The brain had nothing to do with it. It's all coming from the heart. So the heart is making basically the clot. Things like this should be addressed before it converts and causes a stroke. So that's why any symptoms of irregular heartbeat, heart rhythm, you find like shortness of breath, syncope, falling down, this needs to be addressed very quickly, because even if it's a heart condition, it can turn into a stroke. Tobacco use is very important. Nicotine usually in cigarettes tends to cause injuries in the lining of the arteries, and that brings cholesterol and calcium builds up on it, causes atherosclerosis and inflammation, and that can cause a clot. It can block also the amount of blood that can go to the brain and cause a stroke. Alcohol use, physical inactivity, and obesity are modifiable risk factors for stroke. There are other conditions that can be mistaken for a stroke. So you think it's a stroke, but it's not, like hypoglycemia, low blood sugar, Bell's palsy, migraine, epilepsy. Migraine, of course, is a severe headache. Epilepsy. But if you're not sure, just take them to the ER just to make sure it's not a stroke. What are things that you can do to prevent a stroke? Blood pressure control is very important. Know your blood pressure, address it, go to the doctor, get medications. Medications are widely available. You can be 1 or 2 or 3 or 4 medications as long as your heart and blood pressure is under control. If you have a heart condition, just like we said earlier, this needs to be addressed. Smoking, control drinking only moderately. Addressing cholesterol issues, and of course diabetes. And other prevention guidelines, things that you can do is, of course, activity, exercise, physical activity, lifting weights, running on a treadmill, running at high speed outside, low sodium in the diet. Having a circulation problem also needs to be addressed, because poor circulation can lead to clotting. And if you experience any of these things, just don't think about it. Just go to the emergency room or call 911. How do we basically treat stroke? Acute stroke treatments, the ischemic stroke, where there is no blood or clot, causing no blood to go to the brain. We use, just like we said earlier, medications called clot busters. These have to be used within 3 to 4.5 hours, depending on the condition. That's why it's critical to go to the emergency room very quickly. Or they can now do procedures where you go to the hospital, they put a device in and they open the artery that way. And sometimes they put that medicine right into the clot. The hemorrhagic stroke, they can do surgery on it. Of course, medications can be given, but if it gets worse, surgery would be an option, or interventional neurology would have to address it. That's why, again, it is very important to address these issues. Hemorrhagic stroke usually happens more with patients who already are anticoagulated, like on Coumadin or blood thinners, especially when they have high blood pressure, can be also a major risk factor for bleeding stroke. What can you do for recovery? Rehabilitation, inpatient rehab, outpatient rehab, homebound therapy, and also some community-based programs available to help with that. What is the role of your local pharmacist? What does your local pharmacist can do to help you? Blood pressure checks is very important, can tell you if your blood pressure is okay or not. Also, like, it's nice to take your medications and go to the pharmacist and discuss those, whether you already had a stroke, because I'm sure you're on complex medications, especially if you're diabetic. So reviewing those with the pharmacies, maybe on every few months, just to address any errors, anything missing, anything needs to be added, any new guidelines recommended for adding or removing things is also very important. The role of the pharmacist is also very critical in a hospital setting with a stroke, because you want to get the patient in doing a CT scan and the needed things for a cold stroke very quickly. The doctors, the neurologists have to see the patient very quickly, address to see whether they have a bleed or have an ischemic stroke, and then decide the route of treatment. This, just like I told you earlier, you have to go to the emergency room very quick. The emergency room itself has to be very quick. Preventing adverse effects by screening contraindication, making sure that there are no contraindications of the medications that you're taking with your condition. Such if you have like a bleeding ulcer, you have to be on medications for that while you're taking the bleeding medications. That's why things like this are very important. What are some medications that we use to treat, basically, not treat, manage stroke after it happens and prevents the likelihood of recurrency? Certain medications like aspirin is one of the most important drugs that is used for that. Also something called Plavix, or basically it's a cousin of aspirin. They kind of work for the same purpose of preventing platelet sticking to each other. And of course, platelet is what causes the stroke to the clot to build back again. Most of the time, they use one or both of them, one of the medications. Sometimes they use two medications depending on the condition. Sometimes they use Coumadin, which is a bleeding medication, which makes people tend to bleed. So this way, you will prevent developing a clot. This is important, especially if the reason for the clot was an irregular heart rhythm. So basically, if you had AFib, most likely you will be on anticoagulant medications like Coumadin. Now there are newer drugs such as Xarelto and Eliquis. These are newer medications. They're basically, they take the place of Coumadin. They don't take the place of aspirin and Plavix, but they take the place of Coumadin. They're more aggressive medications. And most of the time, if you're taking those, you probably won't need Plavix and aspirin. In some cases you do, especially if you have a heart condition. The doctor has to really manage this on a very individualized basis. It's always a good idea to take those medications and discuss them with the pharmacy, as this is a major reason for adverse events of medications, either duplicating those or just basically missing one or the other. Where it's supposed to be on board. This is very important to prevent further strokes, or to prevent the stroke from the beginning if you have a heart conditions such as AFib. So basically, looking back, the stroke is something that we have to all watch for. If you see somebody close to you having symptoms, you need to discuss it with him and address it very quickly. A loved one that's sitting with you home develops all of a sudden slurred speech. You need to look for these symptoms to make sure it's not stroke and address it very quickly, and immediately take them to the emergency room. Again, we thank you for watching this, and hope you will follow the right steps to prevent stroke and other medical conditions. Thank you very much for watching this again.